The meeting brought together some heads of government, Caribbean ministers of health and their chief medical officers. Other stakeholders included representatives from the Pan American Health Organization, the Caribbean Public Health Agency, the Caribbean Community Implementation Agency for Crime and Security, the Caribbean Disaster Emergency Management Agency, and the cruise ship industry. It aimed to chart the way forward on tackling COVID-19 in the Caribbean, as CAFA has recently upgraded the risk of the coronavirus transmission from low to moderate to high for Caribbean countries. Chair of Caricom, Prime Minister Mia Amor Mottley, said Caricom is seeking resources from stakeholders to wrestle the virus.
As a result of the conversation, one of the things that we did was to establish a framework for an expanded Bureau of Heads of Government to be able to immediately work to see how we can marshal the resources that will be necessary, whether from our partners in the travel and tourism industry, from our partners in the international financial institutions or regional financial institutions, or our local and regional private sector, in order to be able to increase our capacity to contain and manage any outbreak.
Mottley said the Caribbean community will continue to be directed by WHO and PAHO in protecting the region while still maintaining its economy.
We will continue to be guided by the science and the medical officials in this matter, so that we can at all times protect the health of our citizens and all visiting our territories, while at the same time protect the economic stability of our region and our countries.
Chairman of the Caribbean Council for Human and Social Development, Minister Mervyn Joseph, spoke of the commitment made by the cruise ship industry in working along with Caricom in preventing the spread of COVID-19.
I'm particularly pleased with the commitment of the cruise industry to maintain a clear line of communication and to ensure that one critical aspect of managing this risk, and that is to ensure that pre-boarding screening is done in a very extensive and effective way. This type of information will assist not only tourism but the ministries of health to be able to make speedy decisions that will not delay the execution of the ships entering the port and departing as well.
The meeting was held on Sunday in Barbados. For GBN News, I am Rina Pear reporting.